Hey everyone, it's Peter here, and today I'm going to be talking about training through pain or with an injury. And there's a few tips. I get this question often, and I find these tips quite helpful, not only for myself but for my clients. So we're going to go into that. This video is definitely for you if you have an injury and you're wondering how you can continue to get some good workouts in, continue to stay fit, and perhaps even work on that injury. I'm going to put this recording, this narration, over top of a workout that I did. The workout should be playing already. It's about a 10 to 15 minute finisher that I did at the end of my full workout. This 10 to 15 minute finisher is sort of targeting the spring movement, doing a lot of like jumping, hopping, that sort of stuff. Just priming myself and testing things out before a game that I have. I'm just starting my own season in a couple days, so I wanted to put my ankle and my groin through a couple of those movements. So you can take a look at that workout, and I'll be talking over it. So with working through an injury, it can be kind of tricky. A lot of patients ask me how much pain they should be working through. So I have some rules of thumb, and I'm going to dive into it. But first, there's a few things to cover. So first of all, you're probably going to want to actually get assessed by a physio if it's a condition that keeps coming back, if it's something that's worsening, or if there's a chance. And I mean, I would steer on the more cautious side and just get checked anyway. But if there's a chance that maybe some of this pain is coming from a non-musculoskeletal origin, so physiotherapists here in Canada are trained to identify where that pain is coming from. Is it the joint, the tendon, the surrounding area, or something that's referred to where that pain site is, or if it's something more medical in nature. So that's the first thing I'll say is you should probably actually see your local physiotherapist if you have some of those concerns. Now let's dive into actually training because that's why you guys are here, and I have a few good tips that you guys can take away. Before we get into it, if you guys can just like the video and subscribe, it really means a lot. The more positive feedback I get, I'm going to be able to sort of direct the type of videos that I can make going forward. See what you guys like more because I'm pretty flexible with the format. So if you like this type of video, a little bit informative, maybe with a workout in the background, definitely make sure to support and like the video. Okay, so the first rule of thumb I give my patients is 2 out of 10. So if you have a pain scale from 0 to 10, I usually allow patients to work with a little bit of discomfort. Anywhere from 0 to 2 is sort of what I call the safe zone. All right. So that's the first rule. Secondly, I keep an eye on how the area responds to that exercise after the fact. So this is the pain rule that tricks a lot of my athletes, a lot of my patients. Even if your workout feels completely fine during the workout, sorry, even if your injury feels completely fine during your whole workout, but a few hours later, it's achy or that ankle is swollen or red, hot, any signs of lingering inflammation, or if it's worse in any way, you lose some range of motion or that pain shoots up, that might be feedback from your body that the load you put it under might be a little bit too much. You basically did too much too early in most cases. Um, Now, that being said, another caveat is some conditions, I allow that pain rule or that initial pain scale to go above 2 out of 10. Or sometimes I allow some more post-workout soreness. So it is really dependent on the case. Certain conditions respond better, I find, to more aggressive approaches. Sometimes it's not even about the condition, but the person. If you're working with someone that is very apprehensive, it may not be wise to push them extremely hard and get a negative response, especially right off the bat, when building some confidence might be actually more beneficial. So you have to take all those factors into account. But for the most part, if you want some general rules of thumb, I'll summarize these 2 rules. So first, you're going to want to work with a pain intensity during your exercise program between 0 and 2 out of 10. And secondly, you're going to want to make sure that you're not worse in any way several hours later or into the next day. Okay. So with regards to these pain rules, you can apply them also outside of the workout. This is what I always tell my patients. Don't forget about your occupation, what you do day to day for work, or some chores around the house. This will help you avoid setbacks, and it'll help facilitate positive mechanical changes to that injury site. Before we wrap up the video, I'll emphasize that these pain rules may sound aggressive, and for some patients, this is not quite appropriate. Again, you're going to want to check with your physio, but certain conditions, the one that comes to mind off the top of my head I'll mention, but certain conditions you're going to want to actually offload and intentionally work maybe with less pain, be more conservative. And that's patient personality or tendencies aside, but certain conditions actually need a more conservative approach. So for example, one of the pediatric conditions I've been seeing a lot in the clinic, especially this time of the year, a change in terrain with young soccer players, maybe change in footwear, change in training frequency, game frequency. I'm seeing a lot of Osgood slaughter disease, so insertional inflammation at the tibial tuberosities, and oftentimes in the younger age groups, so anywhere from, anytime a growth spurt could happen. So I find them sometimes as young as like 11 or 12, usually not before that. And even into the adolescent years, 16, 17, usually I don't see them much more later than that. So with those conditions, sometimes less is more. I find pulling them out of an activity or deloading them, helping them manage the symptoms, might be a better approach. I'm happy to dive more into that condition one day, because there are some modalities and treatment approaches that are evidence-based that can help speed up your your suffering through that condition. All right, so to wrap up this video, again, if you enjoyed it, if you watched it up to this point, please leave a like for me and a comment. If you have any questions, I'm happy to answer as best as I can. I'm definitely going to be going through the comments. Otherwise, make sure you stay tuned for more videos, and thanks for watching.